Good morning. My name is Dr. Petrakovsky. I'm a professor of obstetrics and gynecology, and the views expressed in this video does not necessarily agree with the views of the institution I'm affiliated with. A while ago, we presented the video that has to do with lung ultrasound to detect lung injury during COVID infections. And it seems that ultrasonography of the lung is the simplest and a reliable test at the same time to detect damage to the lung. Obviously, there's more sophisticated ways to assess lung using X-ray, CT scan, etc., etc. But lung ultrasound appeared to be a pretty reliable assessor of the lung condition during COVID infection. And we clearly take a pride that our practice, one of the first ones that I'm aware of, that picked lung ultrasound based on very preliminary original data. Now I would like to share with you an article published in the Journal of Obstetrics and Gynecology that summarizes the experience with lung ultrasound in coronavirus disease 2019 pandemic. And that's a practical guide for obstetrics and gynecology. And what's really easy and important is that it really doesn't require much, because especially now it's important because we know more than before that a lot of COVID infection are asymptomatic. Asymptomatic absolutely does not mean disease-free. There could be an issue with the lung long term, yet there were no symptoms or minimal symptoms. And I just want to share you how relatively simple it is to look at the pleural line right here under normal condition, when it looks regular, thin, and you look on the bottom, the pleural line in asymptomatic patient with coronavirus infection that actually looks very thick and looks clearly abnormal. You cannot really, it's also interrupted line. So the lesson is that a relatively simple test that could be used on many patients will allow us to detect people either in preliminary stage of the disease, or those who sort of recovered but yet have some sequelae for the lungs. So clearly it's very important now to use every available tool to diagnose in a timely fashion coronavirus, and clearly lung ultrasound is something that a regular qualified ultrasound technician can learn how to do, should be used as well. Thank you and stay safe.